BC is in the midst of a second wave of COVID-19, with cases skyrocketing well beyond what we saw at the beginning of the pandemic. The Fraser Health region has recorded the majority of those cases and has now released some new infographics to give us a clear idea of how far the virus can go. 3 illustrations are based on real case data, 3 real-life scenarios from which one COVID-19 case can bring many people's lives to a halt.
We wanted to showcase and demonstrate what individual cases can do in terms of transmission, and I think these tell a really great story in terms of not only the first layer of transmission, but layers thereafter.
Take one wedding guest, for example. Should they test positive, that's up to 50 guests that have been exposed, forcing them to stay home from school and work for 2 weeks. Say 15 of the guests test positive too. Those people visit long-term care homes, coffee shops, other people's houses. Now, 81 long-term care home residents have to isolate inside their rooms. Household visitors are stuck at home, and your favorite coffee shop is down 5 baristas. One person dies.
There are events that are so-called super spreaders, that a large group of people are get together. So the possibility of exposure is higher. For example, weddings, birthdays, or funerals.
Those cases have been linked to community outbreaks, to private gatherings, to transmissions that we see then spill over into settings like schools, work sites, as well as high-risk areas like hospitals and health services.
Another graphic shows how a COVID-positive person at a fitness class, which are currently closed in BC, could cause almost 200 people to self-isolate. The third graphic shows how a worker with COVID can put 4 other work sites at risk. Epidemiologist Dr. Reza Afshari says Fraser Health did well with the infographics.
You know, it's very difficult to prepare this type of infographics. You need to have people in place, interview many people, test, and then gather the information.
Dr. Victoria Lee at Fraser Health emphasized the efforts of a team of contact tracers made the graphics possible. And when it comes to whether or not the Fraser Health region will see stricter restrictions, Lee says they first want to see cases decrease and stabilize.
If we see that, of course, then there'll be different actions than if we see the opposite, increasing number of transmissions.
She adds that health measures and restrictions are based on evidence, and that these measures are a last resort. In Vancouver, Kier Junos, City News.